A stabbing incident that unfolded in the Edmonton ER, an Edmonton ER earlier this month. But I guess the question is, were the people who work in that hospital, were they shocked that there was violence in the ER?
Not at all. The frontline staff, nurses and doctors, and support staff see violence every day. So I'm aware of a similar, knife pulling episode at the University Hospital within the last several weeks. I'm aware of one in Calgary in the hospitals there in the last 4 weeks. And so this is a weekly occurrence almost.
Wow.
That someone pulls out some kind of weapon. We've had pepper spray released in our emergency department. We've had numerous other weapons found, confiscated. We've even had one of our learners attacked in the hallway with a knife in that ambulance hallway where the stretchers are during her training. So this is a frequent, much too frequent occurrence.
So are we just sort of operating that, well, this is what happens in emergency rooms now? This is just almost to be expected? As you say, there's so many incidents.
Well, I think that the weapons should not be expected, and I think that that's the change that I'm looking to see created with legislation. We understand that there will always be an element of violence in the chaos of the emergency department, and a lot of it is medically related.
Sure.
And so, for example, if you have dementia and you're confused, all the people trying to help you are strangers doing things to you that you don't understand. And so when that elderly person strikes out or reacts with violence, we medicalize it, we understand it, we don't blame the patient for that because we understand they just don't understand what's happening. If you're disoriented on, methamphetamines or some other medical problem is happening, you're psychotic from schizophrenia, then we understand that the violence is not personal, that it is related to your medical disease. You could just have an infection of the brain, meningitis, and be angry and violent. So when people are sick, violence can happen. And we take that as part of the job, and it's our job to identify the potential for that, to mitigate it as best we can, and then not to take that personally as healthcare workers. Yeah. What has happened is that now patients are, not just violent with things that are sublethal, or with the dinner tray in front of them, but they're violent with weapons that they've brought into the emergency department, and we apparently have no power to confiscate.
Yeah, walk me through that. I mean, I've been to ERs in Calgary and in Edmonton, and I'm trying to think if all of them have security. I know certainly some of them do. The U of A for sure has a security post that you have to check in at and things like that. So what is the
voluntary.
Rules? It's voluntary.
So the problem is it's voluntary, and so you don't have to disclose your weapon, and the peace officers are not empowered to search you for the weapon right now because it's a public space. And so the rights of you to carry your weapon are outweighing the rights of those of us in the hospital for safety. And so you can then refuse, right? And if you're medically unwell, we can't refuse you medical care, and you can refuse to let go of the weapon. And so basically you've got it till you use it, essentially. And that is what is so frustrating with this illogical situation. Hospitals should be houses of healing. They should be places where there are no weapons at any time. And the difference apparently with airports or arenas where weapons, aren't allowed in is they're private facilities and they just bar you entrance and say, go away. But we don't have that ability. You might be unwell, so I can't just say you don't get to come in. That's the crux of the problem.
Yeah, I mean, it seems like that's a relatively easy fix. We're just going to require that people that want to come to the ER or have to come to the ER can be checked for weapons, and if they have them, we're going to take them. I mean, that seems like an absolute common sense thing that I'm kind of surprised isn't already in place, Doctor.
Yeah, absolutely. We're shocked as well. And we're even more shocked with the current solution that has been proposed by administration and government, which is that the doctor go and talk to the person who doesn't want to give up their weapon, with a peace officer standing by. So if they pull it out, maybe the peace officer gets to get involved, but that the peace officer will stand by where the doctor or nurse has to go and decide, are you psychotic? Are you unwell? And please don't use your weapon. And so putting the frontline healthcare worker in a position they're not trained for, they're not equipped for, and asking them to make the determination of medical, suitability to be in the place before we say go away, in the setting of a weapon, a known weapon, is ludicrous, frankly. And it's unsafe for the healthcare workers. It is creating burnout. It is creating people wanting to leave an unsafe job, because who wants to be stabbed trying to help other people? That doesn't happen.
Have you made any progress in trying to have this addressed? Like you say, the solution that's being proposed right now, go up and talk to the person, doesn't seem to be an effective solution at all. Are other things being considered? Are talks taking place? Do you think we might make some progress on this, Doctor?
Well, I think that, Minister Jones and Andre Tremblay came to our hospital after the incident, and I think they heard loud and clear from our frontline staff that this is untenable, it's unacceptable, and it can't continue. And what we heard were a lot of words like, well, we can't change this, we can't fix it, this is the law. And so I would suggest to legislators who have a mandate, who pull out the notwithstanding clause whenever convenient, that they can create simple, common sense, as you said, legislation that says that hospitals are weapons-free zones unless you are professionally employed in the police service or the military or whoever deserves to have a weapon in that zone. And so that if you show up with your weapon, for whatever reason, you've made a choice to have that weapon confiscated when found, right, through the metal detectors and the other things that should just be standard in every emergency department across this province. And so then you make a choice. When I show up with my, knife at the airport, I make a choice to lose my knife. And so it should be the same sort of just mandatory, no appeal. You've made the wrong decision, or you go put it away somewhere. Go bury it in the ground outside the hospital if that's what you want to do with your weapon. But do not bring it in. And if it comes in through the doors, you lose it, done. That seems simple.
It does seem simple, and it seems like it would be very effective, and it makes perfect sense. So, Doctor, thanks for walking us through this situation. I'm kind of surprised it's not in place, to be honest, and hopefully we see some progress made, but an important conversation for sure. Thanks for joining us.
Well, thank you for having me.